Welcome to the Elevating La Cultura podcast, a space where I talk with Latinas who are passionate about what they do and are willing to share that passion with others to change the narrative, especially for the next generation. Each season is centered around different topics, but all with the Latina perspective. Welcome as we continue with season 12 with a focus on women's health. It's going to be a great season, so let's get into it. Dr. Louisa Olushoga is a dedicated reproductive psychiatrist with a fervent commitment to women's health. She completed her medical education at the University of Illinois Chicago and residency at the University of Chicago, where she co-created the Women's Mental Health Clinic. Specializing in reproductive psychiatry at Northwestern University, she also served as a consulting psychiatrist for the ERASE Trafficking program, offering vital care to survivors of sex and labor trafficking. She currently works as a consulting psychiatrist at Lawndale Christian Health Center, where she practices alongside primary care providers to deliver psychiatric care to the residents of North Lawndale and the surrounding areas. I'm so excited for this conversation. Hey, I am so excited to have Dr. Louisa Olushoga on the podcast today. We have known each other for probably over 15 years, and when we had less gray hair and wrinkles, but we recently did a podcast panel discussion, and she was on the panel. So I am so excited to have her on as a podcast guest today. So why don't you go ahead and introduce yourself?
Yeah, it's good to be here. I know it's been hard sort of nailing things down to get us connected. But I'm always excited to be here, particularly talking about women's health, which is my favorite to have conversations about. So, like you said, I'm Louisa Olushoga. I'm a psychiatrist. And actually, I think I wear a lot of hats in that regard. So I have a private practice based out of Oak Park. That is dedicated to women's mental health. So, caring for and treating women in and around the biological life cycle that is women, all the exciting, ups and downs that comes with that, be it pregnancy or menstrual cycles or perimenopause. And so I do that. And then I also work full time as a consulting psychiatrist at a federally qualified health clinic on the west side of Chicago called Lawndale Christian Health Center, where I support primary care providers who are seeing patients like in our community and catchment area. And I go into homeless shelters, deliver psychiatric care. I mean, it's just, there's a lot of things. But outside of working and being paid for it, I am mom to 3 beautiful girls, which also fuels a lot of my interest and dedication to and just to women's mental health broadly, because women's mental health starts as young women, and so yeah, so I think that's me, and we have known each other for a very long time, which is funny to think about.
I know, and you've seen me like I think we met when I was pregnant with my first, and
Hmm.
we have just stayed close and connected ever since.
Yeah, I would have to say you've been good at that because I'm a terrible staying connected person. Not because of my heart, but because I just get very easily lost in the sauce. But I'm grateful because this friendship has continued to blossom, and we can be on this side of things, right? Doing the things that we love and being able to support each other in that.
Yeah, one day we will be able to say all the kids are out of the house and let's
Yeah, one day.
live our best lives on vacation somewhere. But since I have known
One
you
day.
for so long, I've kind of been part of or like been a support along your journey, especially as you
Mm-hmm.
went through your education journey and all
Mm-hmm.
that entails. I mean, it can be easy to be like, "Oh, I'm a psychiatrist, I do this, I do this."
Oh, sure.
But like what people don't see is how you got there. And so I'd love for
Oh,
you
yeah.
to describe like all the years of hard work that went into getting you
Gosh.
to where you are today.
Do you know what's funny? I think it was just yesterday I was having a conversation with colleagues. There's a new provider that came on at Lawndale, and she came from UFC, which is where I did my residency. And she asked me something about, oh, do I remember X, Y, and Z at UFC? And I was like, honestly, I think I've blocked it all out. Like, truly, uh, medical training in the years that preceded actually practicing were just really rough for a lot of reasons. And in many ways, it's like I can't remember, which probably is some sort of like trauma reaction to a thing. But I've really blocked it out. I mean, so I can give you, like, I know what I did, but I almost can't even remember, play by play in many ways. But I actually grew up on the East Coast. Jersey is home, and then went to Dartmouth for college. That's where I met my husband, and moved to Chicago soon after I finished undergrad. Always in mind that I wanted to be a doctor. I sort of, um, I don't know. You get kind of like, do I really want to do more school? Because I'm over that, and I don't really like school, honestly, or reading, or all these things that you're supposed to like when you're in, higher levels of education. But after swimming around for a little bit, recognized that there were a few things that I could think of, at least at that time in my life. I feel like I could think of plenty of things now, maybe, but a few things I can think of at that time in my life that I would want to do more than going into medicine. But even when I was doing that, I really was going into medicine with the goal of doing. Interesting. I was always in women's care. Like, that was always something that's something that I went into medical school field to do. And I think that was just born of my upbringing in Jersey City. I grew up in the inner city, middle class family, and just very affected by a lot of the women and young women around me who are single moms and teen moms. And so when I was going to medical school, I had this picture in my mind that I was going to be an, OB-GYN, I was going to be a family doc, maybe even a pediatrician, with a focus on caring for some of these young moms, these moms that were like my high school classmates or peers or whatever, who were getting pregnant. That was the vision I had for myself. And then I was going through med school, and I got to clinical rotations, and I just hated everything. Like, I was just like, I probably made the worst decision of my life, because this is terrible. I think there are various reasons why I felt terrible. One, because the hours are long and you're exhausted. Two, because I'd unexpectedly had my first daughter in medical school, which brought on a very different shift in priority in my life. You walk into to school, you're super excited, you're gonna like change the world. You've got all these visions to yourself. But then when you have a baby, it's like, screw all that. I have this baby that I'd rather spend time with and be with and pour into, but I have to take these exams, and I have to be on clinical rotations. And so medical school was very hard for me, because it was hard, but also because I think my priorities had shifted by a lot. And there were a number of times that I tried to quit and almost quit and didn't. And those are other stories. But the point is, once I was really cemented into medical school by my third year, I mean, at that point, you've spent loads of money, borrowed money, to get through higher education. And it's like, you can't really, I mean, I guess you could turn back, but who's paying back all that money? They don't like refund, right? So I think I sort of stayed the course, honestly. And this is full transparency. I think I stayed the course not because I was like, medical school is the goal, or I feel this calling on my life, or, God told me that this is what I was going to do. And I stayed the course because I was like, I'm going to be really poor and have no way to pay back this debt. And I can't think of a job that I can get with like a bachelor's degree and 2 years of medical school that's going to pay me enough to pay back all these loans that I have to pay. Like, my brain was just, I don't even know how I'm going to do that. Like, I can't even add that on top of trying to raise this child right now. At that time, my husband and I, by the time I was finishing medical school, my husband and I were married. We had Eliza, my first daughter. But anyway, all that to say, like, I wish I could say that being pushed through medical school was a sense of purpose and calling. It was desperation and terror of like, just, I don't know, being like destitute or homeless or something. I don't know. But whatever. We got through medical school, and when you get to a certain threshold with medical school, it's like, okay, well, you're in it. Like, you have to figure something out. But the added complication was that, I started going on these rotations in line with what I had envisioned for myself, and I hated all of them. I was like, I don't actually like kids, right? Like, pediatrics, this just wasn't going to work out, right? I adore my kids, but I have insight to know, like, I'm not a kids person. And like this, they were like all cheery all the time. And then there were their parents, just a lot of reasons I just wasn't feeling it. Family medicine, some amazing rock star people that I know are family docs, but they were just like, be amazing doctors who could do a little bit of everything, and that little bit of everything was way too overwhelming for me. I was like, there's no way I'm going to be like the OB and the pediatrician and the family doc. Like, I just need one thing. Internal medicine, I hated being on the floors. OB-GYN was too surgical. I was like, okay. The thing in my head when I was going to be an OB-GYN was I was going to be ushering life into the world, and it was going to feel like this magical moment. And really, OB-GYNs, they're amazing, but they also are, very surgically minded. And I mean, half the time we finish, be like, oh, what was the sex of the baby? I'm like, oh, yeah, I'm not sure the pediatrician has a baby. Like, they just aren't, like, they were in the moment for good reason. But I went in and out of my first C-section. I was like, nope, that's not it. So, of course, I'm panicking now, third year medical school. And people who knew me were very much like, you should be a psychiatrist. I mean, like, what you enjoy is sitting and spending time with patients. You enjoy, like, putting the pieces together as to how their social context and things are affecting their medical needs, blah, blah. And I was just so irritated every time someone would say things like that because, I didn't go to medical school to be a stupid psychiatrist. Psychiatrists don't even hold a stethoscope. Like, what do they even do that was exciting and could, make me proud? And you can't, like, save someone on a plane being a psychiatrist, I mean, I don't know, I guess it's debatable in some ways, but not really. So there was a lot of my pride that was just, it was rough. And then my psych rotation, they assigned me to like the veterans hospital here, and I was like, I don't even like guys. Like, there's gonna be a bunch of old men. I want to work with women. This whole thing is just terrible. And then I got on that rotation, and I 100% found my people amongst the psychiatric practitioners, like the staff and nurses and psychiatrists and PAs and NPs that were on the floor, but also just amongst sitting with patients. Yes, many of them old men, but also a good number of young veterans. And so then there was like this heart wrestling that I was doing because I clearly had fallen in love with something, but also at the same time didn't want to do that and didn't feel like cool enough, right? So I think there was a lot of pride there, but ultimately became a psychiatrist. I was like, screw it. I don't like anyone. I don't like anything else. I'll just have to deal with myself. And, people are like, what kind of doctor are you? I have to just learn to say confidently, I'm a psychiatrist, not like I'm just a psychiatrist, right? I mean, there was a lot of my own wrestling. But anyway, so we get through med school, psychiatry finally got cemented. I was committed to that. We planned for our second baby, so I took some time off before starting residency with the intention of actually having time and pouring in because I just felt like I was so robbed of that with my daughter. I was blessed to be surrounded by people who really took care of us during that time and made it through, but it was really difficult. And so, got into residency, and then at that point I was just like full in. Like, this is what I'm doing. Come hell or high water. I will continue to deal with and battle the whole I'm just a psychiatrist thing in my head, in which, for the record, I don't think that's accurate. Like, I'm explaining my feeling. I don't think that is consistent with what being a psychiatrist is. But then yeah, so finally felt like I was aligned in life, but then first year of my residency, I got this very unexpected breast cancer diagnosis that launched us into treatment and chemo and surgery and more medications and in the typical ride, right? Losing my hair, losing lots of weight, a lot of sickness, a lot of time off, having my mastectomy, and having to cope with that, but all while trying to continue medical training. And so when I say I have kind of blocked out medical training, it's like I remember it in these moments in time of like, oh, I feel like I remember, but it all feels like sort of a bad dream. In fact, sometimes my husband will say, oh, remember that time we were in? I'm like, I have no recollection of that memory. Like, I don't even remember being there. And I think a lot of it was just how I've coped with, for better or for worse, just what had been a very, very difficult time. So it's also worth mentioning that, my faith, my Christian faith, is very central to the person that I am, right? It's something that I sort of came more in line and connected with in college and, grew from there. And so when I was finishing residency and I was trying to figure out where I was going, for a lot of reasons, I ended up at at Lawndale Christian Health Center, and that's where I've been since I've finished my training. And I've been grateful to be in that space, but that's also a very difficult space to be in because populations that we deal with are dealing with lots of different things. It's one thing to have mental health challenges. It's another thing to have mental health challenges on top of food insecurity and housing insecurity and safety concerns and all of that. So it stretched me in a very, very different way. Um, but I've often said, and I've joked with you, on various times and various occasions, right? Like, I think that, I wasn't the surgeon and, I don't have like the shiny job because like my pride bubble can get so big. Like, and I think God knows that about me. It's like if this goes too much for her, she's just gonna start to think this is all herself, right? Because I was ready to finish residency and get in my red bottom heels with the best outfits, and I was all planned about how I was gonna revamp my wardrobe with an attending salary. And then I ended up at like a FQHC getting paid money, but certainly not what like my peers make, but also doing psychiatry and homeless shelters, and it all just kind of went out the window. So I think that there's so much of what my story to getting here has been that it's just shaped me and just my intentionality that I bring to my work, but it's also just so necessary to keep me grounded in like, everything that I have is just fleeting and like not to get so full of myself, which I could very quickly do. So it like kind of keeps me in check. So anyway, that is the I don't know, 6 minute version, maybe it was 10 minutes, I don't know, version of how we got here today. Oh, and then it probably is worth noting that I circled back around to women's mental health when I learned that that was even an option in psychiatry. When you're in medical school, even when you're going to residency, you don't realize the various specialty options that exist until you're doing it. And then someone's like, oh, reproductive psychiatry. And I was like, ah. So I think this sort of grain of women's health and care for women's health it's been pretty consistent. It just manifested in a way that was very different than what I had envisioned myself when I was graduating undergrad. So here I am, trying to piece it together and help people along the way and retain some of my sanity too in the process.
Well, I have to say, selfishly, I am so glad that you stayed in Chicago because I know that during
Yeah.
residency, like you could be placed somewhere else.
Oh, for
And
sure.
like our friend group was preparing for you not to be here. And I am just
Yeah.
so glad that you stayed. Um,
Yeah, me too. Oh
and I just want to say, my kids think that you are the coolest. So,
my gosh, can they talk to my kids? Because my kids think I'm not the
yes.
coolest.
I remember Elena did like a report and she interviewed you and was just like, "Ah, I know her." And like my kids think that you are
That's
cool.
so
You are
funny.
a legit doctor and
Yeah.
yeah. And so do
Well, I
I.
appreciated it. I mean, I'll take all the, I'll take it all wherever I can catch it because my kids certainly do well. Talk about like ways to keep me grounded. My kids do very well to not let me get too high of myself. So
Yeah. I mean, that's our own kids are are grounding. Um
exactly.
But yeah, I feel like you definitely went through it. And I think that's just a testament to who you are in perseverance and grit and like just also focused on reality because you're like, this is a lot of money. I've already spent a lot of time. And so let's get through it.
Yeah.
And by
Hmm.
trusting that process, you did find your passion and you are so good at it. And I think like our friends are like, oh, dang, I wish like you could be my psychiatrist or like,
Right.
but we're friends, so we can't.
We're friends. I know.
Um,
I know. There's like a blacklist of patients people who can never be my patients, and you for sure are on them. But I'd rather it that way because I want to be your friend.
yeah. Um, so as I mentioned on during our panel discussion, I heard you speak on a panel concerning premenopause, perimenopause, menopause in general, and I was blown away by the statistics of how a lot of the data that we hear is not really focused on like Latino people of color, and
Hmm.
that experience can be so different from the information that is out there. Like I think back to like, oh, menopause, like maybe I'll like that'll happen when I'm 50, 60. And now I'm in my late 30s and having to think about that and realizing that it might come sooner for me because I'm a Latina. And so what have you learned in your learning and your practice and your studies to speak on like the disparity or just the holes of information for the people that you primarily work with, which is like BIPOC women?
Hmm. Yeah. So so it's interesting, right? And I think this is probably broadly applicable to the practice of psychiatry, and certainly confirms things that we already know when we, think about this kind of next category of like just women and women's mental health. And what that is we know that the manifestation of things like, even things like anxiety, depression, mood changes, or even the experience of symptoms or the expression or recognition of signs of certain concerns can look very differently in different cultural contexts. And needing to be sensitive to that, right? And how the words that the person in front of you is using to explain a thing might be related to something that we know exists, but also isn't the word that lines up with like our diagnostic manual and how they would explain it, right? Um, like, you know, in my Latin communities, when I'm working and we're talking about anxiety, there's a lot of talking about like I'm going to do the translation of it because I don't know how to speak Spanish, but there's a lot of conversation around like, an attack of nerves, or like a thing that is really expressing some form of like an anxiety spectrum, but like how do I understand it in a cultural way? Or when a person is coming to me and culturally they're talking to me, I remember when I came into Lawndale, um, I had a provider, a white provider, who I would say is otherwise very present and very works really hard to make sure that they are aware of cultural things. But it's different to know it and to learn it and to come from it, to sort of like, oh, my grandma, my auntie. Um, and I commend anyone and certainly recommend anyone, like, the idea behind cultural sensitivity and being aware is so important. But the experience is different, right? It's like having a male gynecologist who's phenomenal, right? And I've had male gynecologists versus having a woman gynecologist who like bleeds every month and understands what you're saying when I say like this is uncomfortable or whatever. And so anyway, this provider called me because the woman she was postpartum, and I'm trying to remember details. This is very long ago, but basically it was a Latina woman, and she was postpartum, not sleeping much, kind of really anxious about things, first baby or something. She kept talking about these uh, like little figurines, that she was kind of worried about or would see in the corner, or were afraid we're gonna like come take her baby or something like that. And naturally, the provider is like, oh gosh, like, is she experiencing some form of psychosis, some form of like, visual hallucinations that are concerning? And I remember when I got on the phone with the woman, she's like, well, I know that these things aren't going to take my baby, but there's kind of like this folklore about whatever these tiny little figures are, and if they come in the room and they take the baby, I don't know. I don't remember what it was, but the more you talk to her, the more you realize, like, oh, okay, you are actually expressing an anxiety around what you know is like a myth, but kind of feels in my not sleeping like, can this happen? Like, what is really real? And can like also simultaneously laugh about it and be like, okay, this sounds ridiculous. But also, my grandma used to tell me these stories, and it's kind of freaking me out a little bit more now that I have a baby that that I'm worried about, right? Um, and so even when we think in the like broadly psychiatry, like psychiatric thinking, it can look and sound different and can feel different. And our patients of color, particularly our Black men, often get diagnoses, just a mass diagnoses based on trauma and whatever, that become like schizophrenia and bipolar and primary psychosis, when really it's like aggression or even in utero exposure to drugs and your brain isn't quite formed the way, or drugs themselves that has fried your brain. Like there are all sorts of different things. So we none of that changes when we're talking about women and women in menopause. And like, how are we having those conversations? Because me, yes, by just background, my family's West African. Now that gives me some insight into like cultural differences and cultural things, but it doesn't mean I know everything about like my Mexican patient or my Dominican patient or even my Black American patient, right? Like there's an experience of where we are aligned and that we have cultural stuff that we bring to the table and can make room for that cultural stuff, but maybe it's different. And so when we're thinking about women in menopause, um, one of the things is being able to actually have conversations with women of color in menopause, right? We don't know unless we continue. No one is expecting you to just sort of be downloaded with all the data about every culture and how it's expressed. But there should be an expectation of when we are taking surveys, when we are collecting data, that these populations are included. Now we can talk completely separately why these populations are included. Some of it is like women, like no one cares a little bit. But some of it also is just like some of the cultural trepidation around engaging in what is scientific research, right? Like those are big and scary words, particularly in cultures that have been so greatly and negatively impacted by scientific research. And so when you say like, oh, sign up for this so we can keep log, they're like, no, you're not getting my information, I'm not putting my number in there, you're not gonna whatever, and they're gonna steal my social security. You can think of like all the things the sister and the auntie and the grandma's gonna say of like, no, I'm gonna go to my doctor, I'm gonna get this, I'm gonna walk out, I'm not putting my information in nothing, right? So there's a little bit of like a cultural hesitation, right, to engage, and there has been a lot of a um, systemic thing of just ignoring what we actually need to be paying attention to. And so what we're learning now, similar to when I had breast cancer, right? I got diagnosed with breast cancer at 28 with no known family history of breast cancer or like even female cancers in my family. And now granted, my family's from West Africa, so who knows? Like we just don't have records, but nothing that I knew of. But I remember when I was going through that and I was working with an oncologist who, by God's grace, happened to be an oncologist who very much focused on African American women, like women of African descent and cancer, female cancers. And what she said, and I remember her telling me, the reality is in all the data that we have, this breast cancer and female cancers present earlier and much more severely in women of color. Fact. Do I know that fact? In fact, the thing that I was diagnosed with, it was like the initial diagnosis was something called Paget's disease, and it's basically like a nipple or skin manifestation of an underlying cancer. When I learned about Paget's disease in medical school, because we learned about it, it literally was like 65-year-old white woman, blah 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 blah. Like that. The person that was being talked about was not me by any stretch, right? So it highlights this hole that we have had for a long time in understanding what is happening. I think we are now at a space just in time where we're having more of these conversations, right? Like it wasn't until a few years ago that I was like, wait, Ma, did you go through menopause? Like, is that done? And she's like, girl, I haven't had my period in like years. And I was like, when did that happen? It's like, that's something we talk about, right? Like, I don't know, she just did it, right? And I think there was that piece too. So we've got cultural trepidation about being engaged in research systems that aren't working intentionally to include populations of color. And then we've just got like, sort of cultural frameworks that's like, girl, you just do it. Like, I don't know. I was hot, I was sad, I was angry, and I still had kids to take care of and a house to keep up and a job to go to, and you just do it. So this pause of how are you feeling and is it okay and could I feel better? It was like, I don't know, get it done, right? So it has taken a lot of, I think, pieces, a lot of voices, a lot of younger folks, a lot of people of color rising into levels and systems, becoming practitioners, becoming researchers to say, okay, we need to actually do something. But the reality is yeah, it can be so different. I don't think it's impossible for us to work with, but it can be so incredibly different.
Well, I think that is um like it's comforting to know that it's not us, that it's like the greater system and it's just going to take time. But also it's like, oh dang, well, now what? Like how can we like it as millennials, like that's going to be great for like the generations to come, but like how do we as millennials like figure it out for ourselves. So that way we have the words and the next generations aren't like, oh, did you even go through menopause? Like they are more informed. And I think psychiatry or like even therapy, it's hard for it's been hard for me to talk about feelings because there's a lot of those cultural nuances that it's like when I was in my formative years and I did talk about feelings, it was shut down. And so now it's like you said, like we just got to get through it and push through and figure it out because we got lives to live and kids to raise, and there's no time for us to like be in our feelings. But at the same time, we are trying to model to the next generation to understand feelings. And so we are in real time, like trying to grapple with like learning that for ourselves so that way we can teach and model that for our kids. How would you help patients or people navigate that balance of like, okay, I know that like talking about this and trusting the system or trusting a therapist, trusting a psychiatrist is hard in itself because of like culturally lived experiences that date back generations, but also like this is good for you. And so, yeah, like how do you balance that and like help people like trust their providers?
Yeah. So there's a lot of unlearning that we're having to do, right? A lot of undoing, which I don't think is terrible. I think with any growth process, there should be something that, a little bit of like dying to, an old thing and coming out a new thing, to some degree. Um, and that takes a lot of work and intentionality, right? And, I talk often with my patients about, okay, what are the things that are within your realm of control? Like we talk about like locus of control, meaning sure the government, sure the system, sure the man, whatever. Right here in your like Chicago space, in your little thing, what do you have control over that can start to shift a little bit of this narrative and shift a little bit of this conversation? So for me, one of the things that again continues to be work with me for me, and I, to varying degrees, am very transparent about this with my patients about my own difficulty, right? Engaging in mental health, or let's sidebar here, or even thinking that anything about this talk crap actually works, right? Like I live with my own wrestle because I also come to this as a human, right? As a human being that, was brought up in a certain situation and had certain ideas, and those core beliefs are hard. They're like anchored in there, and so I move through despite, and I try to work, but I don't always win, right? And so I think validating the wrestle, because I think sometimes we've shifted a little bit too far to making people feel bad for not being there yet. What do I mean by that? What I mean is, you know, we are now in the age of like social media and more access to information, and everyone's waving their banner of mental health is the best and my therapist is my bestie or whatever. And we've gotten to a point where it's like, what do you mean you don't have a therapist? What do you mean you're not taking care? What do you mean you're not doing this thing and that thing and that thing and that thing, because that's what you're just supposed to do and that's what's supposed to be healthy? And I think we've risked losing the meeting people where they are. There are times I have to meet, and I don't even do what I would consider to be like fully, like full therapy in like a therapeutic way. Like I would hope that any engagement my patients have with me, they consider it to be a therapeutic engagement. But I'm not seeing patients week to week or working through like very real therapeutic frameworks. But at the same time, when I'm sitting with people, it's like the importance of meeting them where they're at is how you are able to sort of help people start to help themselves, right? Because if all I can do is feel shame that I don't have a therapist, and I think mental health is kind of weird, and I think talking is a little bit dumb, and I can't imagine how that's changing anything with my neurochemistry or how I'm feeling today. Like, that's not fair. and I think we've sort of shifted of like, we've done this thing where in an effort to highlight the necessity of caring for oneself and taking care of one's mental health, we've raised it so far on a pedestal that it's left it's sort of left a gap in like, oh, no, 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 it's okay to be uncertain about that. Like, it makes complete sense. And yeah, talking is really weird actually, and it's sort of uncomfortable because it's this random person in front of you who's asking all these really intrusive questions that you don't want to talk about, and you don't like to cry, right? Like, I don't, you don't want to cry. And I just want to go to therapy because I always start crying, and I don't like feeling that way, right? Like, it's a lot to work through, and it's okay. It's okay. So I think where we start, like, it's too overwhelming sometimes to think, how can I change this crazy system? And it can be a bit paralyzing to feel like, oh, the generations before me screwed it all up or whatever, and now I'm stuck. Rather, it's like, what is this thing that I can do today? And for me in my life, sometimes it's with my patients and being candid about, like, girl, I hate taking medication too, but we got to figure out how to get you taking it every day, right? Because otherwise it's not going to work. Or learning to apologize to my kids because my emotions went further than I wanted to. And after I sat with it, I was like, okay, it really was not that deep that she was whistling. I was just really annoyed. And being able to go back and say, hey, I'm sorry. Like, these, what seem like small acts, is what we're doing to change the shift, like change the tide, to shift things a little bit, because those weren't things that we had for ourselves. In the same way, having conversations, with our friends, with our family, with our kids, with our patients or our clients or whomever we're seeing, about how complicated this is, how bad it feels, I think these are the ways that we're shifting. It's not so much of like, because we're signing everyone up for therapy and everyone's got like, the hottest Instagram or whatever. I don't do social media, so I don't even know how to talk about social media. It's actually uncomfortable. But the point is, I just think there's so many small actions that we do day to day that are so much further reaching than this impossible task of, we need to change the system that has failed us all. Like, look, the system has never been great, and it's always failed somebody. And oftentimes people of color have been at the bottom of that barrel. And no, that's not a reason, right? To be like, and so therefore I'm just gonna not anymore. No, now we need to be like, okay, well, what can I do in my space? And so me and my three beautiful, African American girls, we're just going to have different conversations, right? I'm going to be on podcasts with my friend to talk about these things, right? And that's how we're going to start being a little bit more comfortable about being uncomfortable in hopes to get more comfortable.
And that's why I knew I needed to have you on. And that's why I just regard you so highly, because you keep it real and you're not like.
Well, you have to, because like I'm real quick to like cancel, like, so I often say, if you're in my circle, like in my circle of friends, right? It means that I've developed a space with you in which we can be transparent and we can be honest, and that is it. And you know that the person that I'm bringing is genuine, and I can trust the person that you bring. If I have any concern that you can't do that, like, we just can't be friends, because this is the only way that I know how to work. And it's the same way with my patients. I mean, of course, with very necessary clinical and professional boundaries, but like, let's be honest about what is happening, right? Like, my patient will come in, and again, this is not to make light of a thing, right? But my patients who I've worked with for a long time will be like, well, I've been having these thoughts of wanting to kill myself and this and the other thing. And I was like, okay, why haven't you done it yet? Like, walk me through what has kept you from doing it. And I remember I had a student once like, what do you, like, why did you, like, that's crazy. And I was like, but aren't you curious? Like, aren't you curious as to why you landed here versus going through with something that you really felt in a moment? And because it's important for me to open up the door for that person, just to say, yeah, because there's an uncertainty there. There's a little bit of not wanting to, there's a desire to get better, whatever it is. The transparency and the keeping it real is so necessary. And maybe arguably, like, maybe it's just too much sometimes for people, and those people just don't stay my patients, and that's okay. But like, I don't know how else to exist. Also, because I struggle very similarly. Like, how many times I've been like, okay, I really need to get a therapist. I don't have time for therapy. Like, okay, I need to be a therapist. This mess is, like, this is stupid. I'm not gonna. I have tried and failed. Now, real talk. I have tried and failed EMDR twice. Now, EMDR is a like evidence-based, truly helpful treatment, particularly in the realm of like trauma and just experiences, that I have seen just firsthand, even as a clinician, just be so instrumental for people. And I'll sit there and I'll be like, I can't do it. Like, this is dumb. This is ridiculous, you know? And whenever I'm working with my own mental health providers, like, I have to have providers who can meet me there. Because if they start to be like, you're a psychiatrist, you should know better. You should, that's not going to help me, because the inner me, right? Like the inner child in me, the inner hurt person in me, the person who's not all book smart and knows what to say and how it's supposed to go, but the person who actually is inside struggling, they're just going to shut down and not bother anymore. And that's the person that needs to get better. Like, that's the person that needs to heal. So if you're unable to be transparent and meet someone where they are, well, then all bets are off. You might as well just like stop doing this, because this is a waste of everyone's time and money.
So good. I really appreciate your honesty and vulnerability and just being real. You said you didn't do social media, but
I don't.
where can people connect with you and find you and follow you and possibly work with you, hire you to speak, all the things?
Yeah, so I think the best way probably to do that is my website. And making the website was painful because I just don't do those things. Like, I kind of just want to exist in the world, and I want people to just know I'm here and like ask a friend and they'll tell you about me, kind of thing. Wellwomanpsych.com is the best place to connect with me for all needs, whether it's looking for engaging care, if you're just looking for a way to connect with me because you want me to come speak, on that website you can find my email address, and the best ways to get in touch with me via email. I do not have an Instagram. I mean, like, this is what I have. I have a personal Instagram account that I've put one post on for the sake of Instagram algorithms allowing me to make an account. And I just sort of like scroll through the things that I like and I post nothing. And then I have what would be my professional account, which literally in this moment I can't remember if it's like Dr. Olushoga MD. It doesn't matter because I don't post anything on there. Like, I haven't posted anything since 2020 when I first started working at Lawndale, and I have no intention of posting anything now because my life is too chaotic for that. So do I exist on social media? I'm there. I mean, if you want to feel good about like clicking someone to follow, I suppose, but nothing is happening. I think most of what you would learn from me or hear from me happens if you're engaging me through my website or email for us to have a conversation. But that probably, I think, are like the best stops. Or the best stop.
Perfect. No judgment here. I feel like I'm the only one like in our friend group that is like on social media.
No, you are.
Yeah.
You are. Remember, I clicked on this and I was like, this is so fancy. And you're like, is it? I was like, I don't know. It's not Zoom or Microsoft Teams. So I don't know. It looks fancy to me.
Yeah.
I sound like a 70-year-old woman, but whatever. It's okay.
No, it's all good. Before we leave, I always like to ask one last question, and that is, what is some advice that you would give to the next generation?
Mm. Um, I think it would be to be honest. I think that a lot of what me, my peers, my friends, my family, like our what we're learning to unlearn and heal from and sort of work through is just years and years of learning to just do whatever you had to do and push down whatever the actual feelings were. So much so, like we've talked about, that it's hard to even retrieve those feelings now because you've got them so well locked away. Um, but I think if we can get into a habit of teaching this next generation and encouraging this next generation to be honest, I think we actually make room for a lot. I mean, they're going to have their own traumas because let's be real, like life is traumatic, and I'm sure my kids already need to be in therapy for like whatever. Stuff is going to happen. There's no such thing as like not needing help. But I think being honest is a really good gateway to health, honestly. And what does that mean? If I'm going to invite honesty as a psychiatrist, as a parent, as a wife, as a friend, that means that I also have to put myself in a position to hold whatever that honest thing is. That means I can't like go off on you or shame you or judge you. We can have disagreements. We can, we can be of different mindsets and different perspectives. I can even be upset about it. But to invite honesty and to encourage honesty means you have to be able to hold a space for that. And I think it was because we didn't have those spaces well held, probably because, people just didn't know how to do that. We weren't, right? If you can create an environment that allows for it, I think it's going to be so much better. And I personally think that's going to be the key to a lot of things. You can be honest about how you're feeling, honest about what's happening. It's going to drive your ability to communicate and work to communicate. And if it's modeled for you how communication can happen, even when there are big feelings about it, then you learn how to do that better and avoid all the other like trip ups along the way. So just be honest. It sounds so simple, but like, girl, like, don't lie to me. Like, even the smallest thing in my house, I'm like, girl, don't lie. Like, just be honest. Let's just deal with it, whatever it is.
So good. This conversation has been amazing. I appreciate you so much. I hope everyone can connect and follow you. Well, I guess not follow you, but check out your website.
See me. Exactly. You can see me somewhere, I suppose. No, thank you so much for having me on. If there's one thing I love doing is I love chatting, and it's so much easy. It's so much fun to just chat with friends, and any way that I can be helpful, truly, I intend to be.
Awesome. All right. Well, thank you so much for your time, your wisdom, your advice, all the things, and we will chat soon. Bye.
Take care.
I just love Louisa, for real. She is an amazing psychiatrist, so she's an amazing person to reach out to if you ever need more answers as to what's happening as we age. Okay, amigas, thank you so much for listening. Please rate and review this podcast so we can get more ears listening to these stories and can continue elevating la cultura. You can also comment on our YouTube video if you're watching online. I always like to hear from people and how they resonate with the stories that I share. Okay, enjoy the rest of your day, afternoon, evening, whenever you're listening, y nos vemos next week. Bye.